What's going on, everyone? This is Vince with VShred.com, and today we're talking about that post-baby belly. But we're talking about something that goes further than wanting to strengthen your core again and maybe get your flat stomach back. Today, we're talking about the gap that some women develop down the middle of their abdomen called Diastasis Recti. But guys, hold up. Don't go anywhere, because men can develop this as well. I had a UPS guy the other day recognize me and asked me for best exercises that he should do. So if you're out there watching this right now, this is also for you. But this is also for women who have never had children before. So there's a lot of people out there who will benefit from this. And I'm going to show you some corrective exercises that will fix this abdominal separation so that you can continue to train abs and get that flat stomach back in no time.
I'ma keep on going up till the lights go down.
Okay, so the good news is that diastasis recti can be corrected with exercises and stretches designed to optimize deep core muscular function. But before we get into what this condition is and how to help fix it, you might be here on the channel because you're trying to figure out how to get your post-baby body back. If that's the case, the exercises that I show you today won't necessarily help with lowering body fat and building muscle to speed up your metabolism. And yes, that is what you need to be doing. And the fastest way to do that is to figure out which type of training and which eating method is going to be best for your body and your goals. And if you want my help with figuring that out, I did make a free body type quiz. It takes like 20 seconds to fill out. And I give you 3 things that you can start doing literally today to see results. And just a heads up, I will never tell you to cut your calories down to the point where you feel like you're starving. And I'll never tell you to avoid carbs altogether. And I'll never tell you to get on the treadmill if you don't want to. So just click the link in the description below if you want to check that out. But back to today's video. First off, what is diastasis recti? So diastasis just means separation. Typically, doctors are looking for separation of at least 2.7 centimeters between the ab muscles. And recti refers to your ab muscles called the rectus abdominis. So basically, this is just a medical ab separation. And it happens when the space between your left and right stomach muscles has widened. And the 2 large parallel bands of abdominal muscles separate due to the expanding of the uterus. Now, do some women's ab muscles go back to normal after the baby is born? Of course, but there's about 67% of postpartum women have diastasis. And many women don't even realize that separation that they're seeing is a medical condition. They just think that they have line definition down the center of their abs if they're lean enough, and others may describe it as like a post-baby pooch that just won't go away. But the question remains, what causes it? And surprisingly, doctors aren't exactly sure. Some think it's hereditary, others think working out your abs too soon after having a baby, or doing the wrong exercises while pregnant can cause it. And there are also some factors that may make a woman more susceptible to diastasis recti, like having more than one child or multiple pregnancies, especially if they're close together, or being over the age of 35, or having big babies, or having multiple babies at once, like twins or triplets or quadruplets. Now, also, like I mentioned earlier, men can experience this as well. And while it might not be as common, WebMD says that we can get this just from doing sit-ups or lifting weights the wrong way. And women who have never had children can get it as well. And that's because it can occur when anything puts too much pressure on your abdominal muscles, causing them to stretch and separate. Or ladies, if you've had this issue for years and didn't know, or never properly corrected it, it's not too late to fix it. But again, before starting any exercises during or after pregnancy, I'm not a doctor, and I'm also giving out general advice, so be sure to talk to your doctor first. Now, when doing these exercises or the moves that we're gonna go over, make sure that you really focus and move slowly, keeping that mind-muscle connection as much as possible. So first, I want you to understand the concept of drawing the abdominal muscle in and really think about it for all 3 of these exercises. And technically, this is an ab exercise in itself, and a really important one because this is basically stomach vacuuming, which is a very popular exercise amongst bodybuilders to shrink their waist. So for this, you can either lay on the floor or you can do this standing up, but you're gonna take a deep breath in and then breathe all of your air out, all of it. Once you have no more air in your lungs, you're gonna pull your navel almost like you're pulling it towards your spine and up towards your heart. And then you'll hold this contraction and breathe normally for like 5 to 10 seconds. The longer is better. Some people have a hard time breathing while doing this, so if you need to hold your breath, that's fine. Just try to progress to 15, 20, 30 seconds, and then repeat this a few times, maybe 3 to 5 sets. Now, the main 3 exercises, how many sets and reps that you'll do will be up to you and your doctor, but a general number would be maybe 2 to 4 sets of 10 reps, gradually doing more reps as your core heals. But the first exercise are heel sliders with alternating legs. So you'll start by lying flat on your back on a mat with your knees bent and your feet flat on the floor. You'll then engage your abdominals, like I was saying, by pulling your navel in towards your spine and up towards your heart, and then slowly lengthen one leg toward the mat, hovering it above the floor while keeping your hips still and your abs drawing in and up, and then bend the leg back in and repeat on the other side. Now, the second exercise are bird dogs, an alternating arm and leg. For these, you're gonna start off doing just a few reps of just arms, and then just legs, and then both. So keeping your back and your pelvis stable, reach your right arm forward and your left leg back, and make sure that you aren't rocking side to side with this or noticeably shifting your weight back and forth. Also, you're still focusing on that abdominal drawing in. And then you'll return to the starting position, placing your hand and your knee back on the floor, and then you'll repeat that same thing to the other side, and that is 1 rep. So both sides is 1 rep. And then the third exercise are toe taps. For these, you'll start by lying on your back and lifting your legs into a tabletop position with a 90-degree bend at your knees. And again, focus on that abdominal drawing in, then simply tap your toes to the ground, 1 leg at a time. That's all you gotta do. Now, I'm gonna say it one last time. I am not a doctor or a physical therapist. These are just exercises that some of my PT pals told me that they use when their patients have diastasis recti. So before starting any exercises during or after pregnancy, be sure to talk to your doctor. And for more help or guided therapy, you may wanna hit up a physical therapist that can make sure that you're using proper form and maybe give you a few more safe exercises. But either way, you wanna get this corrected. Aesthetics aside, it can cause other issues like lower back pain or bloating or issues with your bladder or your bowels. But I hope this video helped you out a little bit. If it did, be sure to give it a thumbs up button below and share it with a friend, and hit that subscribe button below because we're pumping out tons of content all the time. But that's all for today, guys. I know it was a quick one, but I hope it helped. If it did, again, thumbs up button below. It helps my video get out there to maybe help other people who are also dealing with this, and hopefully they can fix it as well. But thank you for watching, guys, and I'll see you in the next one.